some of the purported benefits would be boosting testosterone, decreasing cortisol. There actually are some data to support improving fertility, semen parameters. Next up on the list, we have ashwagandha. So this is an herb that I think has gotten a lot more attention. Hear people talking about good things about it, or people took it and they felt terrible. And there's not just one type of ashwagandha out there, but some of the purported benefits would be boosting testosterone, decreasing cortisol. There actually are some data to support improving fertility, semen parameters. The increases in testosterone do not appear to be all that robust, somewhere between 50 to 100 nanogram per deciliter in a male, and they haven't been heavily studied as far as I've seen in female populations looking at androgens specifically. Mm-hmm. But who are some of the people that would be looking at seeing whether ashwagandha is a good tool for them?
There's actually several different groups. One group is the group that has mental health condition, for example, anxiety or depression. It's potentially useful. Ashwagandha is a good example of a substance. And again, just to rehash it, medications and supplements are the same. They both have pharmacodynamic effects. That's what a drug does to the body. You can remember this because pharmacodynamic has a D in it. And then pharmacokinetic effects, how the body metabolizes the active compounds. So with ashwagandha, it can be serotonergic. It's potentially GABAergic as well. So some people take it in the evening. And then also, we mentioned its cortisol controlling effect, and potentially its enzymatic effects as well. So depending on the type of ashwagandha, at some point we'll do a deep dive on this because it is a very complicated substance, and you can't just say, yes, this form is for everyone. Some people have a lot of side effects when they take ashwagandha. I believe we've even talked about this before in podcast with Lucas of Gillett Health, but it is one of our favorite supplements, and it is one of the best efficacious supplements in my opinion. So it kind of got on a little rabbit trail there. But mental health conditions, potentially fertility, natural testosterone optimization for sure, hypercortisolism for sure, potentially even insomnia.
Yeah, and since it does seem to modulate or suppress cortisol to some degree, we know that cortisol is catabolic, so does this mean that I should just start slamming ashwagandha when I wake up, because that's when cortisol is the highest?
Definitely not. Cortisol is just like melatonin, as a circadian rhythm. Sometimes we get salivary tests or urinary tests or even just serum tests to look at how the cortisol spike and rhythm is compared to how it should be. But you would expect a cortisol spike in the morning and then low cortisol in the evening. The way I explain it is cortisol kind of gives you a kick in the butt that causes you to get out of bed, which is good.
Yeah, it stresses you out enough, just enough to wake you up is the way that I've heard it described. And I certainly feel like the first hour or two of my day, I do have a bit of alertness, particularly if I don't consume anything food-wise, drink-wise, as soon as I wake up. So I think that's a pretty good summary of ashwagandha. I am looking forward to our more detailed podcast on that, so hopefully people stay tuned.